that despite healthcare workers in the field, there are still millions of Canadians in search of family doctors. A report shows last year 5.4 million adults in this country were without a regular primary care provider, about 17%. More than 26 million adults did have one, that's about 83%. Access is highest in Ontario, about 88% are able to see a family doctor, and the lowest in Nunavut at 42%. With me now to discuss is Dr. Alan Grill, the Chief of Family Medicine at Markham-Stouffville Hospital. Dr. Grill, good morning and great to see you. So 5 million Canadians are without access to a family doctor. How concerning is this number? What are the consequences?
Yeah, good morning, Marcia. This number is very, very concerning. And the study that came out is very consistent with the messages that have been put forward by the College of Family Physicians of Canada. You know, the fact that 5.4 million people in Canada do not have a family doctor, it's quite embarrassing. The number is staggering, right? I mean, can you imagine if we told 5.4 million kids who lived in Canada that they couldn't attend public schools, right? People would be completely outraged. And yet, here we are, 5.4 million people don't have access to primary health care. When you don't have access to primary health care, it significantly weakens your healthcare system. If you look around the world internationally, the strongest healthcare systems have a solid foundation of primary care. Family doctors do a lot of things. We give vaccines to prevent certain diseases and conditions. We manage chronic disease so people don't get worse, end up in hospital, cost the system even more money. We do mental health and addictions counseling. We know that that's a huge problem here in Canada. And we do things like cancer screening, right? We saw during the pandemic that a lot of people didn't get access to that. And now we're seeing more cases of cancer, more advanced presenting to our healthcare system. So it's a staggering number, and we need to fix this quite quickly.
Okay, and my next question then is why? I mean, I've spoken with you enough over the years to know you love family medicine. Is it just not as attractive to med students to go into family care? What are the reasons behind this shortage, doctor?
Yeah, so I'll be clear again. I love what I do. Family medicine is a wonderful specialty. We get to see patients, what we call from almost birth to grave, throughout the life cycle, right? Newborns, kids, adolescents, young adults, seniors, people that require palliative care when they have end-of-life conditions. These are all the things family doctors do. The problem is there's three main issues that I think right now are system problems that are creating a lot of stress within family medicine. So number one, the amount of paperwork and administrative work that we have to do is unbelievable. Studies have shown most family doctors spend an average of 19 hours a week on paperwork. That's things like filling out insurance forms, writing prescriptions, trying to figure out where to refer your patients. And this is 19 hours. That's almost like 2 full working days where we're not in front of patients. We were trained to be with patients, to help them, to quarterback their care. We're spending 19 hours away from the patient. So that's number one. Number two, there's a lack of access of team-based primary care. You know, patients are living longer. I have quite a significant seniors population in my practice. These patients are complex. They need more time. But I happen to work in a practice where I have interprofessionals helping me out, like social workers and pharmacists. So I can take a complex patient, and I don't have to do everything for them. I can delegate some of the work to my colleagues. They can help me out. That opens up time in my schedule to spend with patients, opens up time to take on new patients. But across Canada, we don't have equity in this. In Ontario alone, only 30% of patients have access to this care. And finally, running an office is becoming much more expensive. Inflation's going up, cost of rent and staff, all those things. We have to do that. These are our expenses that we have to pay for. And in family medicine, because we're trained to do things like low-risk obstetrics, emergency work, hospital work, a lot of family doctors who are finding it challenging to run an office because our income hasn't increased with inflation, they tend to work in other environments that are of high need where your overhead is less. The problem is that takes away from the comprehensive care that people in Canada deserve. So if we fix those three problems, not only will family doctors be happier, but we'll start attracting a lot more medical students to go into family medicine.
Dr. Grill, thank you so much for all that. Clearly, it is a problem, a challenge with a lot of layers to it. Dr. Alan Grill is the Chief of Family Medicine at Markham-Stouffville Hospital.